By practicing moderation, varying your approach, strengthening pelvic muscles, and addressing emotional needs, you can enjoy the benefits of self-pleasure without compromising your long-term sexual health. Balance is the guiding principle. Honor your body's needs, nurture your relationships, and seek professional guidance when needed. A reliable erection is the result of a complex interplay between hormones, nerves, blood vessels, and psychological factors. Men looking for natural ways to improve erectile function are often drawn to vitamins and supplements that promise quick fixes. One nutrient receiving attention is folic acid, or vitamin B9. Widely known for its role in preventing birth defects during pregnancy, folic acid is now being studied for its potential impact on erectile health. But does adding more of this vitamin truly help? This article examines the scientific evidence around folic acid and erectile function, explains how the vitamin may influence nitric oxide production, and offers practical advice for men seeking to enhance sexual health safely. Why folate matters for erections. Erection physiology hinges on the availability of nitric oxide, NO, a molecule released by nerves and endothelial cells that signals penile smooth muscle to relax and blood vessels to dilate. Without sufficient NO, the cascade that fills the corpora cavernosa, the erectile chambers, with blood cannot occur. Folic acid is a key cofactor in the biochemical pathway that produces NO. In theory, low levels of folate could limit NO synthesis and impair erections. This hypothesis led researchers to investigate whether men with erectile dysfunction ED have lower folic acid levels and whether supplementation could improve symptoms. The research so far: a recent meta-analysis pooled data from 9 controlled studies examining the relationship between folic acid and ED. The researchers assessed serum folic acid levels in more than 980 men with ED and compared them with nearly 850 men without ED. On average, men with erectile problems had significantly lower folic acid levels, and the deficiency correlated with the severity of ED. Although this association does not prove causation, it suggests that folic acid is an important factor in sexual health. The same analysis looked at trials where men with ED took folic acid supplements daily for approximately 3 months. In these studies, men completed validated questionnaires that measure erectile function. The results showed statistically significant improvements in erection scores for those taking folic acid compared with those taking a placebo. Interestingly, when men with diabetes and ED took tadalafil, a PDE5 inhibitor, plus folic acid, they experienced greater improvement than those taking tadalafil alone. Diabetes often damages blood vessels and nerves, making ED harder to treat, so the combination of folic acid and medication may be particularly beneficial in this group. However, the meta-analysis also emphasized that most studies were small and of short duration. Doses varied widely, from 0.4 milligrams to 5 milligrams daily. A dose of 5 milligrams is far higher than what is typically found in multivitamins and may require a prescription. Side effects reported in the studies were mild, headache, flushing, back pain, and no participants stopped due to adverse reactions. Despite encouraging findings, the researchers noted that larger, longer studies are needed to establish optimal dosing, duration of supplementation, and long-term safety. Folic acid is not a miracle cure. It's tempting to view supplements as simple solutions for complex health problems. But high-dose folic acid is not a guaranteed fix for erectile dysfunction. Taking a supplement does not address underlying conditions such as cardiovascular disease, diabetes, hormonal imbalances, or psychological factors. In addition, excessive folic acid can mask symptoms of vitamin B12 deficiency or interact with medications. Before starting a high-dose supplement, discuss it with a doctor who can assess your overall health and determine whether testing or treatment is needed. Certain medications, including anticonvulsants and drugs used for cancer or rheumatoid arthritis, can lower folate levels. If you take these medications, your doctor may recommend supplementation as part of an overall plan. Men who take anti-seizure medications should never adjust doses without medical supervision. Because folate is water-soluble, excess amounts are usually excreted, but extremely high doses may cause nausea, loss of appetite, or sleep problems. Dietary sources of folate. Rather than reaching for supplements, a safer first step is to increase natural folate intake through diet. Folate is abundant in legumes, lentils, beans, chickpeas, dark leafy greens, spinach, kale, Swiss chard, cruciferous vegetables, broccoli, Brussels sprouts, and fruits such as oranges, bananas, and melons. Whole grains, nuts, seeds, eggs, and liver also contribute. In many countries, grain products are fortified with folic acid to prevent deficiency. A diet rich in these foods not only increases folate, but also delivers fiber, antioxidants, and minerals that benefit cardiovascular health. By focusing on balanced eating patterns, men provide their bodies with the building blocks needed for nitric oxide production while supporting overall wellness. The bigger picture: cardiovascular health and lifestyle. Erectile dysfunction is often an early warning sign of systemic vascular disease. The same risk factors that damage coronary arteries, hypertension, high cholesterol, smoking, obesity, sedentary lifestyle, also affect the delicate vessels supplying the penis. Improving erectile function requires addressing these root causes. A heart-healthy diet, regular physical activity, weight management, stress reduction, and quitting smoking remain the cornerstone of prevention and treatment. Sleeping 7 to 9 hours per night helps regulate hormones and promotes endothelial repair. Mindfulness, counseling, or cognitive behavioral therapy can alleviate anxiety and improve sexual confidence. For some men, treating obstructive sleep apnea or managing depression may restore libido and erectile function. When to seek medical advice. If you're experiencing persistent difficulty achieving or maintaining erections, schedule a comprehensive evaluation with a healthcare professional. ED can result from endocrine disorders such as low testosterone or thyroid disease, neurological conditions, multiple sclerosis, Parkinson's disease, medications such as antihypertensives or antidepressants, or psychological factors. Blood tests may include fasting glucose, lipid profile, hormone levels, and vitamin status. A doctor can help identify treatable causes, determine whether folic acid supplementation is appropriate, and offer evidence-based therapies. PDE5 inhibitors such as sildenafil or tadalafil have well-established safety profiles when used correctly. For men who cannot take these medications, other options include vacuum devices, intracavernosal injections, intraurethral suppositories, and penile implants. Counseling and couples therapy are also valuable for addressing relational and emotional factors. Takeaway: folic acid plays a role in the biochemical pathway that generates nitric oxide, and research indicates that men with erectile dysfunction often have lower folic acid levels.